Thanks so much for being here today. I'm Stephanie from BuzzFeed, and I write about the health and technology space. So I'm excited to be here today to talk about something that is, or has the potential to really change the way healthcare is delivered, and that's the notion of the patient actually having greater control of how they get their health care and then how much they know about their own health and wellness at any given time. So that's thanks to smartphones and apps and other wireless medical devices. And we've got a great panel here today to talk about just how those things are changing healthcare. So here with me today, we've got Vic Gundotra, the CEO of AliveCor. We have Peter Shalek, the CEO of Joyable. And then we have Jason Oberfest, the CEO of Mango Health. So I'll just start with you because you're sitting next to me. So Vic, if I've got an irregular heart rhythm, that's kind of a serious medical condition, right? Why would doctors trust patients to take care of that themselves when it's really a potentially life-threatening situation?
So you're right, it's a very serious situation. Heart disease is the #1 killer of men and women, even exceeding that of cancer. It's a huge issue in this country and around the world. When you're diagnosed with a heart issue, one of the most serious kinds of heart issues you can have is an arrhythmia, atrial fibrillation, where your heart basically flutters. In fact, 1/3 of all strokes are due to this flutter. So the question is, why would a doctor trust us to be able to diagnose that? Well, we produce a very small device you can buy on Amazon. It looks like a stick of gum, and you just hold it, and it will do an EKG on your mobile phone. FDA cleared. And we have algorithms, machine learning based algorithms, that will diagnose you as being a normal sinus rhythm or being an AFib. And many people who have AFib, it's intermittent. So when you go to see your cardiologist, they do an EKG, you may be normal. And then what do you do when you feel something's going on and you're at a soccer game or you're at home? So these things go undiagnosed. And if they go undiagnosed, they can't put you on life-saving treatment, like a Xarelto or an Eliquis or another anticoagulant. And so being able to enable a patient to be at home or wherever and to catch that AFib by having an EKG they can perform on themselves is nothing short of amazing. It's not just catching the AFib, sometimes it's just telling the patient they're normal. And where they don't go into an anxiety loop and really worry, they can check. We hear that all the time. You go to the Facebook forums, atrial fibrillation, or you look at the Amazon reviews, people regularly say, among the top things they say is, it just gave me peace of mind. I thought something was wrong, I did an EKG, and I was fine. And I think the reasons doctors can trust it is because it's FDA cleared, which is not a very easy thing to go get. Get a 510 cleared, and we've got a long history of being accurate.
Yeah. Well, cool. And so, Peter, so when I think about mental health issues and getting help for that, I think that the image most people have immediately is going to like a therapist in person, taking time out of your work schedule to go see somebody in person. So how is technology changing that notion with what you guys are doing?
Absolutely. So the primary challenge with behavioral health is that the vast majority of people don't get help.
Do you want?
Hello? Sure. Thank you. The challenge in behavioral health is really different from most other parts of healthcare, in the sense that the vast majority of people who need help don't get it. So unlike anywhere else I know of in healthcare, 85% of people who suffer from anxiety or depression don't have access to adequate help. And there's a whole host of barriers that cause that. And people talk a lot about the cost of care. It costs $160 on average to see a therapist across the country. That's weekly. The stigma associated with it, the convenience, the accessibility. And what technology allows people to do is to access care when and where they want it. It's tremendously easy to start. And if you suffer from anxiety or depression, the process of getting help it's overwhelming at times to make that decision. And we found that by making it really easy to start and by providing something that is trustworthy, that people really believe in, that we're able to unlock these tens of millions of people who today don't have access to a basic healthcare service.
And so Jason, it's a really big, stubborn, and well-known problem that people don't take their medications even when it's like a really life-dependent thing. They forget or whatever reason. How can technology change this problem that's been going around for forever?
Yeah, you're right. It's a huge issue. Can you guys hear me, by the way?
Can we have the mics work?
Do you want to?
All right, sure.
You're right. It is a huge issue, and for us, that's part of what we're focused on. But more broadly, even, is the idea of building products for patients and clinical programs behind those products that really inspire anyone with chronic disease to rethink how they manage their health every single day. Our fundamental premise is that you have to build and earn a daily relationship with a patient to actually influence their outcomes over time. And especially in the chronic conditions that tend to be asymptomatic in nature, where the patient may not be feeling the effects of the disease every day. And unfortunately, that's many of the largest, most difficult chronic conditions, including many of the cardiovascular conditions that Vic mentioned. So for us, medications is a really important part of that. It's a part of healthcare that has very clear unit economics around it. So if we can turn that around, we can create very immediate value in the system. But we also establish a really strong daily relationship with patients in the course of doing that we can use to support them with many other components of care every day. So for us, medications is part of it, but it's also much broader.
So the notion of patient-centered healthcare sounds really great and like empowering and all this stuff. How do you actually prove that it works? I mean, because healthcare has been centered around medical providers and doctors for so long, how do you show that a new model with the patient at the center can actually work? And how much evidence do you actually need to build to prove to consumers or to investors or whoever that it can actually, come up with outcomes? Anyone?
Sure, I'll take that since I have a working mic. Our greatest proof is in that we are not a reimbursed product. People spend $99 out of their own pocket to buy this product. And our sales are largely due to recommendations by cardiologists and word of mouth. And so we see the effect based on patient stories every day. And that's a very, very powerful thing. We also see the effect in our personal lives. I know with my situation, my father had a cardiac issue that almost killed him. We could see over a period of 3 months his deteriorating health. He couldn't go up a certain hill, and we could see that decreasing. When he went to see his cardiologist, they did an EKG, and they said, "Paul, you're fine, go home," because they had a single point of data. But as families, we were monitoring that. We could see the decline. And so we see that with our product all the time. People don't do one EKG. They do many EKGs a week, and they monitor their progression or, in some cases, a regression of their health, and they bring that to their doctor's attention. That's brand new. And science didn't have that kind of capability until recently. And for a patient to walk into a doctor and say, "Look at my data," that's enough proof.
Yeah. Well, you mentioned you don't need to worry about reimbursement because people just kind of spring for it out of their own pocket. So is that the key? Just like to figure out how to bypass, insurance? And what do you guys think?
Hello? Yes. I do think that the onus of outcomes in digital health should be exactly the same as the onus of outcomes in in-person health. We're dealing with something that is tremendously important and personal to people, and we should come at it from a place of you need to do what works first. And when we built Joyable in the idea of creating something that was truly client-centric, the most client-centric thing to do is to actually help people. And so we started from what is the best literature available, what are the absolute best things you can do for people, and then wrap around that the sort of delight and engagement and make that as easy as possible for people. If you do it the other way, you risk building something that is helpful or that people like but doesn't actually help them. To your question, it is having people buy your product simplifies everything. I mean, it allows you to say, are we creating something that is valuable enough that someone wants to pay for it? If you think about buying a car, you would never buy a car without knowing the quality of it, reading Consumer Report, or knowing its price. And yet, that's exactly what people do in healthcare all the time. Even if you want to know the price of a service, calling a hospital to ask about price is one of the most frustrating experiences you can possibly have. And so We found that just giving people that information about cost and quality and allowing them to figure out what is efficient and what they want is a huge step toward solving this problem over the long term.
Any thoughts, Jason? Whoa.
You guys hear me? Hello? Yeah. Put this one down. Can you hear me now? How's that? Can you hear me? I'll hold this really steady and hope that fixes it. It's interesting just listening to each of us talk about the parts of healthcare that we're focused on. I think they're very different and very complementary. So for what Vic's doing, it completely makes sense that you would drive the business through purchases of a device that's incredibly valuable. For us, we take a very different approach. We want absolutely the least amount of friction possible to get interventions into the hands of patients. And for us, that's pure software and that's free software. And that's software that's compelling enough where people are really motivated to download it, to recommend it to others. The challenge I think we all face in generating evidence is that we are trying to marry data that's never existed before to traditional clinical decision making and traditional clinical practice. And that's a really tricky thing to do. And especially when, in order to generate that evidence, you have to work with very traditional healthcare organizations that, for very good reason, in a lot of cases, take a long time to make decisions about how they run, deploy, test, and measure programs. And so for companies like ours, I think it's a very difficult situation to build and operate a great consumer service that patients love, and at the same time, focus on working with the leaders in healthcare that you need to generate the evidence that proves that your products work. And that's what I spend most of my time thinking about, is how to really balance those two things in a very effective way.
When we talk about patient-centered healthcare and this notion of the patient using technology to monitor themselves more and look out for their own, warning signs more, where does that leave the doctor, right? So the doctor historically is the one you go to with any questions, and you have to go in person or whatever. How do doctors feel about what you're doing? And are they happy about it? Are they, are they confused by it? And is there a role for them to play? If so, at what point? I'm maybe interested in hearing what you say to start, because yours is kind of an urgent thing.
Yeah, sure. We love cardiologists. 40% of our purchases come from a recommendation that a patient has heard from a cardiologist. And I think doctors will continue to be the ultimate arbitrators of trust. That's your physician. But that doesn't take away from the fact that nobody cares about your health more than you do. And with these modern tools, you have a chance to take control of your own health and supplement what your physician is doing in a powerful new way. I think that's all good.
Yeah.
For us, it's really about reaching a new population of people who need health, or need help rather. In the United States, there are 790 people for every one licensed therapist. And according to the NIMH, 1 in 5 people suffer from a clinical level of anxiety or depression. So even if a therapist was working 9 to 5 and seeing a patient every hour, and every therapist in the country was doing that, you'd still only meet a quarter of the demand. So that leaves 40 million people without access to care. And what we found is that by providing a service that helps those folks who aren't getting help today, we're able to give them a solution when the alternative is nothing. And as a result, most of the therapists we've spoken with are tremendously excited about this, because it can be a gateway for someone who otherwise wouldn't get any help to begin to get some help.
So they don't see it as you potentially taking away patients from them, or
The vast majority of people we've spoken with do not see us that way and are really excited about it. And we've had many therapists refer people to us, and we send some of our patients or some of our clients who aren't a good fit for Joyable to therapists. That's not to say that some people don't view it that way, but the way we see and position our service is really to tap into a new market of people who are not being helped today.
So on that note, just real quick, so your app currently helps folks with social anxiety,
Yes.
right? So how do you, since there's like a spectrum of mental health issues that people can have, how do you reach out to someone who doesn't just have social anxiety, but also maybe is just like actually chronically depressed? Is that, at what point do you kind of bring other professionals in to tackle more serious issues?
Yeah, so we have a really thorough protocol that looks for certain behaviors that indicate that somebody can't be helped by Joyable and needs more intensive services. So in mental health, that's things like risk of self-harm, suicidality, or if someone, for instance, has PTSD, then research would show that treating social anxiety with cognitive behavioral therapy is not the best thing to do. So we have this really thorough protocol, triggers to look for, and when someone has one of those triggers, we have responses that we provide them that say, it's your health, it's your decision, but you should know that literature shows that you would be best served if you were doing this other thing, and here's a list of resources.
So you point people outside of the app when, at a certain point, you don't pretend to help everybody.
All the time. In fact, if you come to our site and you take the quiz, which is a clinically validated measure of social anxiety, if you don't have social anxiety, we say, hey, Joyable's probably not right for you. We want to help the people we can help, and people who we can't help, we want to get them to the right service.
Yeah. Jason, I can't imagine that medical professionals would be upset that their patients took medicines more regularly, but do you ever run into any kind of tensions with them over what you're offering and what they want to have control over?
Yeah, it's a great question, and when we launched the company, to be honest, I wasn't sure how the program would be received. And I think that question is broader than just physicians. I mean, there are many on the front lines of care who play a really critical role, whether it's nurse practitioners in ACOs and organizations like that, case managers play a really critical role, pharmacists play an absolutely critical role also, and we really weren't sure in all cases how our programs would be received. What we've seen is that consistently what we hear is all those professionals seem to be grateful that the app kind of takes care of an initial front line of communication and support with the patient that then frees the professional up to have higher value discussions with each patient. And so their time, they feel, is better spent on more important complex issues, and they seem to appreciate that. So I think for us, that's a really important thing to know. I think in general, part of the issue in healthcare around all of these things is that it's such a complex organizational system. In almost every case, a physician absolutely no doubt wants great tools for patients and is very interested in data from patients. But in a system where they're working in mandated EMR systems where it's very cumbersome to do business every day and serve patients every day, it becomes much more complex. So I think there are a lot of parts of the industry that are improving and need to continue to improve to actually free those who provide care up to actually use tools like ours to ultimately improve outcomes. And that's a really critical part of what needs to happen going forward, I think.
So if you guys feel like you're playing a role in lifting the burden a little bit on busy medical professionals, what are your challenges for your companies and for the industry as a whole right now?
Sure. I'd say the biggest challenge for us is overcoming skepticism. People who are suffering from social anxiety today or other mental health issues, we talk a lot about the barriers that I mentioned, the cost and convenience and stigma, but people would do anything to improve themselves if they could. Like if you know someone who's suffering from depression, they would do anything. And the biggest challenge is they don't believe that a digital solution can work. And that's why having transparency about outcomes is so important. So that when people show up, they trust what you're offering and are willing to make a very vulnerable purchasing decision to come and to try a new service.
Yeah, I think for us, in a similar way, but we're more focused on building trust with clinicians. I mean, there have been a lot of tools in the space that are patient-facing that often aren't very well built, that don't have a lot of clinical evidence. And, we've worked very hard to address both of those things, but we have a burden of proof to deliver to the industry to really make them believe in tools like ours. And that's a big task. It's a big industry with a lot of stakeholders in it. So for us, I think that's the biggest challenge. Yeah.
How about you? What's your biggest challenge?
I'd say we have probably two big challenges. One challenge is awareness. As a small startup, you don't necessarily have the means to have huge marketing budgets and let people know what your service is. And so we consistently hear, gosh, I wish I would have known about this device earlier. And so that's a big challenge for us. Another challenge, which is on the other end of the spectrum, is what do we do with our data? We've collected 6 million EKGs. And through machine learning, we can infer all kinds of things from that much data. Many of these people are healthy. But how do we do that in a responsible clinical context while preserving people's privacy? And so we're grappling with all those kinds of things. But I think those are positive problems.
How do you make decisions about what to do with data?
Privacy first. And so the first thing we think about is, what can we do with this data that still respects the patient's privacy? And then number two, because we're in this new modern age of machine learning, what are the positive things we could learn? So for example, alcohol and atrial fibrillation is dramatically linked. There's clinical studies that show the effect that alcohol has. Most people don't know this. Right? And we wonder through our data, what other things could we figure out that could be helpful to people? And those are the kinds of things we're working on right now.
Yeah, it's really interesting. I didn't know there's a link either, actually.
Yeah.
So we've got a little bit of a mix of technologies up here. We've got apps, we've got a wireless medical device. What new or emerging technologies are you guys seeing coming up, and then are curious about in terms of its potential to further patient-centered healthcare? Conversely, what are some hype technologies that you're not as excited about?
That's an interesting question.
Yeah.
I think the ones I'm excited about, I think precision medicine and personal genomics for sure, without a doubt. I mean, if you just think about the idea of patient-centered healthcare, the potential there is absolutely fascinating to me. I think for me, and I touched on this earlier, the challenging areas are the more mandated-driven technologies that are influencing the system and are fairly cumbersome, and I think create a lot of friction in the system. And for us, I think we hope that will change and will continue to change.
Okay.
So far, speaking specifically to mental health, I think that wearables haven't lived up to the hype, really. They don't have the level of biofeedback necessary to inform people about an anxiety attack they're having or to give them control over changing. There are, if you went and saw a doctor, they do have more complex equipment that allows people to use meaningful biofeedback. And so I'm particularly excited about the next generation of wearables that can measure things like heart rate accurately, that can measure perspiration, and that could allow Joyable to find when someone is starting to feel more anxious. You're sitting in class and you're about to raise your hand and you begin to perspire, and then could actually cue you with something that could calm you and put you in a better place. So I'm very excited about, I don't know if it's the next 2 or 3 or 5 years, where wearables will go.
Right, beyond just steps, but actually cued to your reactions to things. That's really interesting. How about you?
Well, I agree with Pete. I think the next generation of wearables is going to shock us with their accuracy. You can see them getting better and better. But I would also add to that is deep learning, artificial intelligence, what we can do with this data. Does exercise help or hurt your heart condition? Today, we have the data to know across millions of people based on your cohort. And that's just one of many examples of the kinds of insights that we're about to derive for the first time. And I think that's going to lead to much, much better outcomes.
So just finishing that sentence, so ideally, maybe someday there'd be like a coach, like an AI coach that would say you should exercise now, or you should refrain from exercising?
I certainly believe that's going to happen.
Okay. Do you think that if you had to make a prediction for when that might happen, you'd say next decade or 2 decades, or?
I think that's going to happen within 18 months.
Oh. So pretty quickly. Okay. Well, cool. Well, I think we're just about out of time. So thanks so much to my great panelists for being here today, and thanks to you all for being here too.